Okay, hello everyone. So today will be our sixth and last lesson, and we'll be focusing on digestive conditions that we commonly see in children. So yes, we have come to the last lesson of the whole series. So these are the conditions that we will be talking about today. So mostly digestive conditions and also bedwetting, which we see in older children above the 3 years of age. And last, I will be going through a set of general health maintenance points, which you can do on your child. This one I've briefly gone through in some of the previous lessons due to popular requests. So today we'll just be doing a slight recap. And before I begin introducing the various digestive conditions, we need to do a little recap about how TCM looks at our digestive system in general. So in TCM, the digestive system is considered the foundation of life for its ability to digest, absorb, and distribute nutrients to the body. So we say that it is in charge of transformation and transportation. So it transforms and transports the food we eat. So we take the food we eat and then we transform it to tea and blood, the two very important substances that are needed to carry out functions. And then the spleen helps to move these nutrients, the tea and blood, around the body to various parts of the body. So maintaining a good digestive system is the basis to good health. So a lot of set of acupoints, you will find that conified spleen is one of them. And another of its function is that the spleen also helps to transport fluids around the body. And what happens when the spleen fails to function? What kind of symptoms do we see? So first thing, the digestive function can get affected. And these are the symptoms that can be seen. So things like stomach ache, poor appetite, indigestion or bloating, diarrhea, constipation, and vomiting. So these are the digestive functions that can be affected. And then when spleen gets affected, the transportation of fluids also get affected. And when these fluids in the body, they don't go to where they're supposed to be, they accumulate in the parts of the body, they result in what we call dampness. So this kind of dampness develops internally, a little bit different from the dampness you get externally, so say from our humid environment. So dampness has the characteristic of being heavy and hard to get rid of. So when we have dampness in the body, in the lower limbs, some people get like swelling in the lower limbs. And since qi can't rise to the head with this dampness, it can also present with feeling groggy in general, feeling heavy in the head, and feeling tired, like very hard to get up, this kind of sensation. So if the dampness gets to the joint, it can then result in joint pain, or like arthritic rheumatic pain, because in TCM we call this like feng shi, wind and dampness. And a common indicator of dampness that I find to be very accurate is having sticky stools, or like having the feeling of unfinished business. So this one is something that you can observe on your own. And also, of course, another symptom that you can observe will be your tongue. So people with dampness, they will tend to have a thick coating on the tongue. So in children, what can affect the spleen and cause these digestive disorders that we mentioned just now? So one thing would be external coldness. So this includes the exposure to cold environment and including foods that are cold food that we eat. So cold and raw food such as cold drinks, raw vegetables and salads, or like not covering up in air-conditioned places, especially the abdomen area, or having the fan blow directly at the body. So all of these can allow for cold to enter the body and affect the spleen and stomach. We say that the spleen and stomach, they require yang energy or qi to digest the food we eat. So you can think of the stomach as a cooking pot, which requires fire to get the food cooking, just like how our yang energy is required. So when you put frozen food to cook, you require more heat, right? Or like more time to defrost the food before it even starts to cook. So same for the body. When we have cold in the body or like when we eat cold food, the stomach has to use more energy to warm up the food we eat before it can use them to digest them to become nutrients. And over time, this spleen qi gets affected. It gets used up more quickly than it's replenished. And this time, the digestive function will then be affected. So for TCM, you always hear the physicians recommending to drink warm water, avoid cold food and drinks. So cold food and drinks refer to food and drinks that are literally cold, so like from the fridge, and also those which are cooling in nature, like raw food is one of them, or like cabbage, winter melons, bitter gourds, watermelons. Melons basically are cold in nature, cooling in nature. So you can wonder like how why is it okay for Japanese to eat sushi? Like isn't it raw and it's usually cold as well, right? This is because they usually eat it with warming ingredients like wasabi and the preserved ginger. So same thing for yourselves. You can eat this cooling food with cooling properties, of course, but it's just that when we prepare them, you can add a little bit of ingredients to help to neutralize the cooling properties. So things like cinnamon, ginger, or pepper are some of the common ingredients that can be used to counteract these cooling properties. And then the next thing we have is improper feeding. So giving your child too much fatty, oily, or sweet food. So we say that these food items are more difficult to digest. And same thing over time, it can burden the spleen and stomach systems and weaken them. And when that happens, you may observe a loss of appetite in your child. And the last point, we have gone through this when we talk about children's physiological characteristics, how they are naturally, even for healthy children. So children naturally have weaker lungs and spleen because these organs are not fully developed when they are born. So this affects the absorption of nutrients and could present as poor appetite or frequent diarrhea or loose stools. And on top of that, children require lots of adaptation to changing diets to meet their nutritional needs. So like first milk, then the addition of solid foods, and then slowly increasing the variety of food. So as a result, they need to adapt and they need to grow. So they develop imbalances in their spleen very easily. We also often see digestive symptoms like bloating and colic. And in infants, it might just present as general fussiness or frequent crying at night. You can also observe that when a child recovers from other conditions, such as cough, fever, or the common cold, the digestive system is easily weakened from medication and the body's effort in fighting the illness. So it's also common to see children having poor appetites right after such illnesses, and they take a while to recover. So in such a period, it is good to give them something that is a little bit blender, a bit easier to digest, so that their spleen system can recover on its own. So now we'll talk about the first condition, constipation. What is the definition of constipation? Constipation happens when there is a decrease in frequency of bowel movements or the passing of very hard and dry stools. So it is often defined as having less than 3 bowel movements a week. But in fact, everyone actually has different normal bowel patterns. So this goes for adults as well. Some children can have bowel movements only once every 2 to 4 days, and it's normal for them. And others have them like 2 to 4 times a day, and that's their normal. So different people have different normals. So constipation is when a child has bowel patterns that are different from his or her usual, or when he is obviously passing very dry and hard stools and straining to get them out. Also, infants can have very varying bowel patterns. It can be common for breastfed or formula-fed infants to have as many as like 1 bowel movement after each feeding to as little as 1 bowel movement every 5 to 7 days. As long as he's not feeling uncomfortable, he's not showing any discomfort or straining to get his poo out, it is considered normal. There's nothing you need to do about it. So it can be very different at every stage of life. So for breastfed or formula-fed babies, they can have like large soft bowel movements without pain up to 5 days apart, but generally it decreases to 1 to 2 times a day after 6 months old. So you will move towards the adult pattern. You would also often hear us talking about consistency of the stools, whether sticky or loose. So in TCM, we focus a lot on that. So normal bowels should be soft, banana shaped. So of course, for infants, when they are having milk only, it's normal to have a bit of looser stools lah. But as the child ages, when solids are introduced, it will become the usual banana shape. And we say that stickiness would mean that there's dampness in the body, and usually having very loose stools very often would mean that the spleen is deficient. So sometimes the parents can even when they start to strain to pass their bowels, sometimes you can even observe blood in their stools or on the toilet paper. So if it's fresh red in color and the child is having constipation at that same period of time, it usually isn't a cause for concern. It usually comes from the anal area as a result of straining when passing the bowels. So constipation can also be accompanied by bloating, changes in appetite, frequent complaints of stomach ache or discomfort. And once constipation begins, it tends to become a vicious cycle. It continues. So the child becomes afraid or unwilling to pass their bowels because it's painful. And then this just worsens the condition. So we should try and solve constipation when it's in the early stages. So constipation itself is often a benign condition, which means that it is nothing serious. And it is often related to dietary, lifestyle, toileting habits, and rarely due to any serious diseases. So when does constipation commonly occur in children? Children commonly get constipation during the transition to solid diet, such as moving from breast milk or formula milk to solid foods. And very often it may be due to the lack of fluids and fiber. Doctors don't recommend water for babies, so I won't comment on that. But you can give your babies fruits and vegetables to help loosen their stools. So fruits like prunes, bananas, papayas, and avoid giving them too many of these baby teething snacks, these teething biscuits. As too much of them can actually result in heatiness in the body and can lead to constipation. And also constipation can also occur during toilet training, moving from diapers to potty. Some children may feel uncomfortable and they may refuse to poop. So we call this withholding their poo. So the most common reason is that if they pass a very large or hard or large stool, they feel pain from it. And then they start to associate pain with passing bowels. So they start to hold it in. But yeah, of course, some just aren't used to using the potty or toilet bowl. This one requires a little bit of coaxing. So it's good to put a stool under their foot so that for potty, you can just make sure that their foot is on the ground, a height that they can put their foot on the ground so that they feel more secure. So withholding issues. And also, some children also get constipation when they start going to school. So they might withhold their stools as they don't want to pass the bowels in school. They feel paiseh about it. Or sometimes children can ignore the signals that their body gives. So they get too busy playing and doing their things that they forget to go to the bathroom. This can happen as well. The TCM constipation syndromes can be broken up to 2 broad categories. So excess syndrome and deficiency syndrome. We mostly see excess syndromes in healthy, regular children. So I'm not going to introduce a set of acupoints for the deficiency syndrome. So with excess syndrome, the child has too much heat in the body, which dries up the stools, giving these dry and hard stools that are difficult to pass. They also present with other heat symptoms like bad breath, thirst, yellow urine, and when the bowels get stuck, tea gets stuck as well. So we say that the digestive tract needs to be flowing, so qi needs to be flowing in order for a smooth digestion. So when everything gets stuck, the person can get poor appetite and bloating. And the tongue will appear red with a thick coating. The vein on the finger will be purple. So for deficiency syndrome, I'll just go through these symptoms. So the child does not have enough qi in the body to ensure the smooth flow of the digestive tract. So the stools may not necessarily be dry and hard, but the child just doesn't have enough energy or qi to pass them out. So this kind of children would appear more tired, appear pale, and have issues with weight gain. And the tongue will appear pale red, and the vein on the finger also pale. So here are the main acupoints for constipation, the excess syndrome, this one. So we have clear large intestine. This one is on the index finger. So you have to do this 500 times. So we do this from the point where the thumb meets the index finger and outwards towards the tip of the index finger. So this is the first one. And then the next one we have clear liu fu. So this one is on the little finger side. We do from elbow crease to wrist crease. And then we also have up, push, nei, ba, gua. So all of this is they try to help to clear heat. Clear large intestine is a very direct one. For large intestine, the qi is stuck. We want to clear it. So we also have next one, the third one will be up, push, nei, ba, gua, 200 times. This one we will be we want to regulate the qi in the body because qi is getting stuck. And then after that we'll move on to points that we do on the stomach. So we have Ni Zhong Wan. Ni Zhong Wan will be in the middle of the stomach. So we take one point where the ribs meet, or like the end of the breastbone to the navel, and then we take the midpoint. This is Zhong Wan. So we need for 2 minutes. And then we will need Tian Shu. Tian Shu are on two sides of the navel, 2 cun away from the navel on each side. So you can massage them together using the middle and index finger. So this is for 1 minute. And then we will do circular stroke fu. So this one we do it 100 times. In fact, actually this circular stroke fu, you can do it more times, as you can do it multiple times a day to help if their constipation is really stubborn. And then a relatively new acupoint over here that we haven't mentioned in the last lecture would be to push the qi jie gu downwards. So because we want the bowels to come out, so it's the downwards direction. So it should be quite literal and easy to understand. So we can watch this. Yeah, so it's done in a pretty quick fashion. So you can start doing from the, actually it's from the lumbar L4. So we have 5 bones at our lower back, and we do it we start from the 4th one. You can just imagine it to be where they wear their shorts, the line that is in line with their shorts. So around there and then down to the butt crack. So that will be about it. And then we have some supplementary acupoints also. So for children who have very obvious excess heat symptoms, we will want to add more acupoints to help to clear the heat. So clear Tian He Shui is one of them, push inwards. So we have gone through a lot of times. And now we have also clear liver and lungs heat. We will push them outwards. The second finger for liver and the 4th finger for lungs. So heat in the spleen can affect liver over time. That's why we want to clear heat from the liver. And also for the lungs, lungs and large intestines, they are body organs. So clearing the heat from the lungs can help to also clear heat from the large intestine. So if the heat is very serious, we want to go in from there. So okay, and then some general tips to help with your child's constipation. Of course, encourage your child to drink plenty of fluids and cultivate a habit of drinking plain water. So get them used to drinking plain water while they are young, before they get the taste of sweet drinks. So it's easy to fall in love with the sweet drinks. But yeah, so introduce them to plain water when they are young, so that they are okay with drinking it. So you can cultivate a habit of reminding them to drink water during regular intervals of the day, so that they get the habit of drinking water in general. And get your child moving, because exercise stimulates digestion, stimulates the movement of the intestines. And for babies, since they can't move about, you can massage their stomach, so using the circular stroking. So that's why I said that one you can do it more often if you find that their constipation is very stubborn. Just that move alone. And also include fiber-rich foods in their diet, fruits and vegetables, whole grains and beans also. So again, fruits like prunes, bananas and papayas, dragon fruits too, and also apples and pears with their skin on, because this is where the fiber comes from. And vegetables, just to include the variety, a lot of vegetables have a lot of high fiber, and you must include the leaves, and both leaves and stalks. And avoid giving them too much sweet and heaty foods like biscuits, sweets and chocolates, so like fried food, fast food. And for children who are afraid of pooping when stools get slightly hard, you can try implementing a reward system where you provide them with non-food rewards after completing a bowel movement. So like a trip to the playground or stickers. You can also try to get your child into a regular toilet habit. So you can have your child sit on the toilet at least twice a day for at least 10 minutes. And you can try doing this after a meal, as the intestines get to work right after a meal. And if you are using the normal toilet, so make sure he has a footrest so that his knees are up. This makes it easier for bowel movements. And also make going to the toilet a pleasant time. Don't get mad at your child for not having a bowel movement, because we don't want him to relate any like negative connotation, negative thoughts, or negative experiences with passing bowels. So children are very sensitive. So for children who can forget about going to the toilet when they are playing, you can start a toilet routine, get them used to having toilet breaks while they are playing. I don't have any super effective herbal teas for constipation in children, because the most important factor still comes from their diet and having enough water. So fiber actually helps to bulk up the bowels, making them easier to move through the digestive tract. But if they don't get enough water to move these bowels along, it can sometimes worsen constipation. So after giving a high fiber diet, remember to also give them enough fluids. That also applies for yourself if you experience constipation. So now we'll move on to poor appetite and indigestion. Everybody okay with these acupoints and in general? So here we would refer to children who have a decrease in appetite, whether it's due to recovering from a recent illness or those that happens without any rhyme or reason. This can also be accompanied by bloating, vomiting, or bowel changes. Usually these symptoms come together. So to a certain extent, a decrease in appetite during the toddler stage can be normal, because during their first year, babies grow rapidly. So they gain around 7+ kg in the first year. But between 1 to 5 years old, they normally gain 2 kg plus a year. So growing slows down, and because they are not growing so fast, they need less calories, and their appetite might decrease. But if your child is not gaining weight like the usual, or they always seem to take a long time to have their meals, you can provide some massage to stimulate the spleen system. So these are the two common syndromes we see in children with poor appetite: food stagnation and spleen deficiency. So again, one excess syndrome and one deficiency syndrome. So poor appetite usually comes with frequent bloating or burping. And for the first syndrome, food stagnation, Again, there will be heaty symptoms because we say that food stagnation in the body causes tea to stagnate, and then over time it accumulates heat and sometimes dampness as well. So we see all the heaty symptoms: bad breath, thirst, smelly stools, passing smelly gas, yellow urine. And when the heat gets really bad, it can affect the sleep to cause restless sleep. So this brings me back to the phrase that I introduced last week, 胃不好则卧不安. So imbalances in the stomach results in poor sleep. So there can be also stomach ache and constipation. And this type of excess syndrome, the stomach ache usually gets better after bowel movements, since like food is getting clogged up in the system. Removing some of them would make the symptoms better. So in TCM, we see the passing of bowels as a method to get rid of heat in the body. So the tongue, in this case, can appear red with a thick white coating, and the finger vein will be purple. And another type of syndrome would be spleen deficiency or qi deficiency. So for this one, the child usually would appear smaller than kids of his age. They can have cold limbs and loose stools, or they generally get stomach upset or diarrhea more easily than others. So this is because the spleen is not strong enough to handle different types of food. So in a way, having motion sickness, feeling queasy on moving vehicles, or being lactose intolerant, or generally being intolerant to different kinds of food, we say that this can be, in TCM, we say that this can be due to spleen deficiency. And also the very common syndrome nowadays, irritable bowel syndrome, where people get stomach cramps, diarrhea, or constipation very easily. This one is also seen as spleen deficiency in TCM, and also liver stagnation. I would say that generally we see pretty good effects for this condition with the use of TCM herbs. So here are the acupoints for poor appetite. So generally we want to stimulate the digestive system and strengthen qi in general. So these are the acupoints to do so. We have tonify spleen at the thumb 500 times. And then we have meat panmen at the fleshy area of the below the thumb. Again, up push nei ba gua, used to regulate qi in the whole body. And then for this, we have nip si heng wen. Yeah, so someone mentioned rubbing si heng wen. So for nip si heng wen is a strong stimulation. So you do it 10 times. If of course, if you're doing rubbing or kneading, you can do it more times, no problem with that. Some children will find this a bit too painful. So if they find it too painful, you can switch to kneading. That works as well. Then we have push apart fu yin yang. So this one over here. So you can push apart right under the ribs. And then we have Zhu San Li. Zhu San Li is a general acupoint to help to strengthen the spleen and digestion. So it's below the kneecap. And then we have Nie Ji. Nie Ji, we also do it 10 times. Okay, and then we have the supplementary acupoints. So again, with very obvious heat symptoms, we want to increase the heat clearing points. We can use clear tian he shui or clear stomach. So the clear stomach is directly below the spleen acupoint. It's also beside the panmen. So panmen is at the fleshy part of the palm. Clear stomach will be at the side. So for clearing, we want to push from the wrist crease to the base of the thumb outwards. And then if accompanied with constipation, we want to push downwards 剔节骨. But if accompanied with frequent diarrhea, we want to use tonify 三关. So this one helps to increase yang energy. So remember that we said that the spleen requires yang energy to help with digestion. Yep. So this one helps with yang energy. So again, some tips for managing children with poor appetite. So first thing, children should be offered a balanced diet so they acquire enough nutrients and they don't develop these digestive issues. And generally, meal times should be an enjoyable time. So try not to do force feeding. So it makes meal time more of a punishment for them, which shouldn't be the case. And if they're averse to eating certain foods, try to incorporate them into other dishes so that they are able to accept them. Like for example, vegetables. Try and use colorful vegetables so that at least the visual aspect of them, so that it interests them in the first place. Also try to introduce them to a variety of foods before they turn 1, so that they are familiar with the different tastes and smells, so that when you introduce them in the later part of their childhood, they don't find it very strange. Avoid cold food and drinks in general. This one we have mentioned just now, they are cooling in nature, bad for the spleen. And set times for meals and snacks and try to stick to them. It is perfectly fine to give them some snacks between meals, but take note of the quantity and try to choose healthier snacks like yogurt and fruits. Nuts maybe for older children, as they can be a choking hazard. Avoid giving snacks or giving hungry kids cups of milk right before a meal, because this one, it can lessen their appetite and make them less willing to try new food being offered. And avoid giving too much junk food like candy, potato chips, chocolates when they are very young. So it's easy for them to like this food. So same thing for sweet drinks lah. But they might not want to eat the normal meals after they try all this food, and they might ask for them. So just don't keep this food in the house, and if they ask for them, you can say that you don't have them. And then you can offer 2 healthy snack options to choose from. So remember that toddlers, they like to be in control. So you give them simple choices, makes them wanna do it instead. Set good examples at the dinner table. So do not engage in other activities while eating, like watching a phone, watching TV. And if your children doesn't want to eat, again, try not to force feed. Focus on feeding yourselves. Children like to copy what their parents are doing, and who knows, they might just pick up their spoons and follow suit. So now a very common soup recipe for strengthening the digestive system. I believe this one we have mentioned before also. So also remember the Chinese yam porridge that I mentioned last week. That one will help also. So you can make that, and then on top of that, this one is a soup recipe. So 4 deities soup. So it uses 4 ingredients, which are these 4 deities. So we have Poria, Fuling, Qianshi. I think when you go to the Chinese medicinal stores, you might have to use the Chinese names. You can take a photo of the slide. So and actually they usually they have a pre-packed. It's a very common recipe. So some of them they have pre-packed the soup that is already pre-packed with these ingredients, or like they have them already powdered in the powdered form, which you can just add to whatever they are eating or mix in water to give it to them. So we have this 芡实, 15 grams, and then we'll be using lotus seeds also, and Chinese yam. So all of these ingredients.
So do you have the recipe on PowerPoint?
Yeah, I don't have it on the PowerPoint. Later I'll be sending. Also, I have made all the PowerPoint slides into a PDF, which I will send it to. I'll find some way to send it to you all lah. This one for now you can take a photo of it, because these recipes I added after I did the handouts. Yep. So with these 4 ingredients, they help to strengthen the spleen and also remove dampness, which affects the digestion, right? So for this one, we usually cook with pork ribs or chicken bones, depending on your liking. So this one is very simple. You first blanch the pork ribs or chicken bones and set them aside. So get rid of the blood and impurities. And then you wash these herbs and just add them into a pot these ingredients, it's not necessary to soak them also. And then after that, you put blanched pork ribs or chicken bones together with the herbs, and you cook for around 1.5 hours to 2 hours, and that will be it. So you can also add some like China barley, 15 grams of China barley, or like 4 to 6 pieces of red dates and some ginger slices. So red dates is mainly to sweeten the soup lah. Also depending on your liking. Some ginger slices would be to neutralize taste. This one can taste a bit starchy, the soup. So ginger in TCM actually also helps to warm the stomach and promote digestion. So an interesting fact is that ginger helps to reduce nausea also. So the soup is generally quite starchy in taste and doesn't have a strong herbal taste. So most children should be able to accept it. Although I have heard of some who still don't take this. Yeah, but you can try to give them earlier age, so that they find it easier to accept. So if you are not using the dried Chinese yam, you can also use one entire piece of Chinese yam. That works as well. And then next, I also have this tea over here that helps with food stagnation. So adults can take it too, especially like when you have had too much to eat or after a celebratory dinner. Then you can have this to help with digestion. So this one, we are going to use malt, hawthorn, which are the main ingredients, and sharon, this almond fruit. So malt can actually help with the digestion of carbohydrates, and hawthorn, they can help with the digestion of meat. And this fruit over here, this almond fruit, it helps to strengthen the spleen and regulate the flow of qi. So for malt, since it's the main ingredient, we'll be using more, 15 to 20 grams is fine also. And then for hawthorn, you can use 5 to 10 grams. They are sour in taste, so you might have to experiment a little to see what taste your little ones can accept. For the malt, right, you have to place in the tea bag so that it's easier to take them out after that. So for this, you boil in water all the ingredients for 10 minutes, or simply steep in the cup for 20 minutes. You can also add a little bit of sugar if your child finds it too sour or they don't like the taste. So for this recipe, it's not good to cook for too long. So 10-15 minutes is okay. Yep, so I've actually finished the first part of the lesson, the two conditions, poor appetite and constipation. Yep. So if you have any questions, we can do them right now before I move on to the next part, diarrhea and bedwetting.
Excuse me, doctor. May I ask whether it is too much fiber causes bloatedness? Number one. Mm-hmm. Number two, why some taking ginger sometimes causes more gas. But I know they say it's supposed to be clearing gas or bloatedness. Mm. That's the second question. And the third question is when you were saying boiling the chicken or whatever, that the earlier recipe that you will have to throw away the blood and the first boil, you are supposed to boil and throw. Will you not be throwing away the nutrients?
Oh, this is
there are three questions.
Okay. So the first one, the fiber one. Yeah, so fiber, like I just mentioned also, the fiber actually helps to bulk up stools. So if you don't drink enough water, it can actually result in like constipation, and it can result in clogging up intestines as well. Yeah, so a key thing is not to take fiber. You can also you cannot take too much fiber also, although it's said to be good for digestion. Yeah, that's what you have to fiber.
So you have to go down with more water.
To drink more water.
Okay.
Yeah, you must remember that fiber only adds bulk to the thing. So you can imagine if it adds bulk to the bowels, if you don't drink enough water to push them out, it will still. There are cases where people get like the constipation worsen after taking fiber. Yeah, as for ginger, sometimes it may be just that your constitution is not suitable, so that or your problem is not due to, let's say, spleen deficiency in the first place, then maybe due to other issues. That's why this ginger might not be effective. Then in that case, might have to explore other options lah.
And or can reduce the amount and test as it goes along.
Yeah, you can also reduce
Okay.
the amount or reduce frequency.
Okay. And the third question, the nutrients you were saying.
Yeah. So for that one, so this one, the pork ribs and chicken bones.
That's right.
Some people like to blanch it, so it's you quickly boil it and then you just take them out. So not so much of the nutrients lost lah. This one is up to personal preference.
So when you're boiling it, sometimes you have the froth that forms upstairs. So can you just then remove the froth and then just retain that soup and add in the rest of the herbs? Is that what it meant?
That works as well, but as in it just depends on your preference lah. Some people like to boil and then they get rid of all the froth because it's blanching. Shouldn't affect the nutrients too much.
Okay, I appreciate that. Thank you.
No problem.
How often should we drink the 四神汤?
Oh yeah, this soup actually as in you can also drink it every day. It's not these food are all staples. Yeah, so it's not dangerous. It's just whether you get tired of drinking the same thing every day. It's more of that lah.
So gao tang, it means to boil the bones to get the stock. Whether it's
broth.
chicken bone or lamb bone, is it okay to drink it every day? Because it's a bone stock.
Yeah, it should be fine also because this is your regular stock that you use to cook soup.
Yeah, just
You don't
plain.
have any issue with
No
that lah.
issue.
Coming from the TCM perspective lah.
Because I think that maybe the bone got too much calcium, or that go into the soup and then you get calcification of the somewhere.
No, I don't. Usually it doesn't. As in, and anyway, usually calcification happens seldom because that there is too much calcium. It's more of because so like sometimes muscles can have calcification. It's because we are sort of giving a lot of pressure to it. So you see, it's your body's way of wanting to better your system. So because you are using so much pressure, or like it has micro tears, or it has a bit of stress in the area, it makes it stronger. So that's why calcification happens. But of course, if the calcification affects the other surrounding structures, that's when you start to have pain. Yeah, so calcification usually doesn't happen because you have too much calcium, but rather because as a form of degeneration.
So once you have this calcification in your muscle, will it go off or not? Or will stay there forever?
It usually doesn't, but the symptoms can be, so usually for this kind of issues, we treat the symptoms lah. We treat the pain or whatever that is affected in either your range of motion or like the pain.
I see.
Yeah, because for degeneration issues, we don't talk so much about cure because it is a result of wear and tear, and there isn't really anything that can bring you, back to 20 years before. But symptoms can definitely be helped with like using either medication, acupuncture, or like physiotherapy. Yeah.
Also during the tuina, the stroke, or the circular the stroke, especially, you say 500 times. I find it so difficult to achieve 500 times. When I do it on my baby, wow, 100 times already the skin so red, like it's so I stop after when they see it's so red.
Okay. There are two possible causes. Like one might be that might be using a little bit too much strength, or one might be that the baby. How old is your baby?
3 months.
Oh yeah, because they are very young, under 6 months. So the number of times that we write over here in the handouts, they are generally targeted at 6 months to 1 year old.
Oh.
So if it's lesser than 6 months, yeah, you're right. You lower, reduce the number of times that you need to do for them. You can start off with like half.
even
Or even like you say, you
100
didn't even do
already,
half, right?
100 already very red. I don't use stroke because I put a lot of oil and that on my thumb. Then I just
Ah,
stroke, 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 stroke.
Yeah, you start
Quick
with
stroke.
lesser lah. So if you find that they are turning red, yeah, you stop doing the stop doing the stroking,
Even
and
for
then you
the
see whether they have the effects.
pinching, how many times do we need? The full set. We pinch the
Mm.
whole back. How many times do we?
Usually 10 times.
10 times. Okay.
Yeah.
This is also
So
very
usually
good.
what I would do is pinch up 5 times,
Uh-huh.
and then remember last time I showed you before the pinch 3 times, pull 1 time, pinch
Yeah,
three
yeah,
times,
yeah.
pull 1 time. Actually, sometimes we'll do 5 of the normal ones, and 5 of that.
Okay.
Yeah, that's what we do clinically lah.
Okay. Good.
Mm-hmm.
5, 5. Okay. And it seems that, especially the stomach problem, I train do the what the round around,
The
circular
stroking.
movement around the navel,
Okay.
and also the from the breastbone you press downward 3 times. The last one is after the navel. I do not know what is it called, but I just do it on.
Oh, let me
Uh,
see.
yeah, this push 负
Okay.
负阴
Yeah.
负阴阳
Yeah, that's full. The stomach one.
yeah
Push apart.
yeah 10 times, right? But I don't really do more than 10 times because I find that it's so red already. And
Yeah,
also
you can change the number of times to do it lah.
okay, and can it be complement with the normal massage, like I that stroke, that I love you stroke, to if you have constipation, can it be complemented with that?
Oh, what is that stroke that you are talking about?
The because I also took the Western massage for baby, so when they say that,
Okay.
they say that you can, we were taught the I love you, that stroke, the massage, and
Oh, so
together with,
it's on the stomach?
yeah, it's also on the stomach, the
Mm.
navel side, the whole stomach area.
Mm.
Is it okay if I use both, the push apart full yin yang, and
Mm.
because if he's constipated, I try to sort of give him more
Mm.
than
Okay.
it can
It
be.
shouldn't be a problem lah.
Yeah, so
Because what we are aiming is to stimulate the movement of the digestive tract. And
okay.
basically the massage techniques are all rather gentle. Yeah.
Okay.
So it shouldn't be you just observe the symptoms lah. So if their constipation is relieved, then you can maybe take away one of the steps that you are doing.
Okay, and this baby also have the problem of puking. The after drinking, he will just throw out milk.
Mm.
Is that the problem of the stomach or gas or something like that?
Yeah, usually we also say that it's because of gas, or it's because of the skin and stomach system not working well. So by right, the qi should be moving downwards, like how the digestive tract goes. This one is when the qi comes upwards. So we want to
So now,
regulate
what do
qi
you
also.
recommend? The tonify the spleen, or
Usually you will see that, like when we want to tonify the spleen system, these 3 steps are always there: the tonify spleen, neat panmen, and also the up push, neat aqua.
oh,
Mm.
need man, the
Yeah,
bakwa.
so these three will usually like it's like a, if you talk about, like, it's like a formula that we will use together.
How many times can I do? Must do it to see the result?
Usually we take 10 times as one treatment course.
How many times a day?
1 time a day, so 10 days.
Oh, 10 days.
Mm.
Okay. I already started 2 days ago, so let's see how it works.
Yeah, then of course if it's
when you say 10 times one course, is it daily, every day?
daily, so like 10 days lah. 10 days.
10 days.
10 days
Consider
of
as one
massage.
course.
like one
And
treatment
subsequent?
cost. Subsequently, of course, if the child is still not showing improvement, then we got to explore other ways already to help with the system, to help with the condition. Or you can change the acupoints. Maybe some acupoints are not targeted at the problem. So yeah, that's why we take the 10 days as a treatment course. After 10 days, if it's not working, then we have to try other things.
Let's say it works very well. Then
Mm.
subsequent this little baby will maybe say 1 week, 2 times or 3 times. Does that work?
You can do that also. So it's quite flexible. Either you can do it every if it's working well, you can do it, continue doing it 2-3 times a week. That is fine. Or you can also reduce the points. The acupoints that you are using. You focus more on the general health maintenance kind of acupoints. Like last time I showed you the set of acupoints before. Yeah, maybe move on to that.
Okay, thank you.
Basically, these acupoints are pretty safe lah, and quite flexible. So it depends on how they respond. So okay, would you like I think we take a 5 minutes, or like we take a break until 10 lah. Then you can come back at 10. Then we'll go through diarrhea and bed wetting. It's 10 o'clock, so we will start with the second part of the lecture. Okay, so we will move on to diarrhea. So okay, what does diarrhea, how is it defined as? Diarrhea refers to increase in bowel movements or passing of loose and watery stools. So in here, we are going to be talking about both acute diarrhea and chronic diarrhea. So acute cases are those when a child may have eaten something wrong, or they simply have a gastrointestinal virus that results in them having diarrhea. So chronic can refer to a child having loose stools in general, or being prone to having loose stools. So here are the symptoms. We have the acute ones. So acute, as what acute means, symptoms that comes about very quickly and last for a short duration. So again, we have food stagnation and dampness heat. So honestly, these are very similar. They are both excess syndromes. So the poo will be smelly, containing undigested food or milk curds, and the child can have tummy aches. So heat symptoms for both as well. Thirst, body feels warmer than usual, bad breath, yellow urine, restless sleep. So for pediatric massage, right, for the massage that we are doing, we don't really have to differentiate between these two syndromes. So the important part, right, is just to differentiate between excess and deficiency syndromes to know whether we do clearing methods or tonifying methods. So for this differentiation between food stagnation and dampness heat, it's just more of to let you know that there are two syndromes out there. It's more applicable when we are using TCM herbs lah. Then there will be different herbs that we use for food stagnation and for dampness heat. So main acupoints for acute diarrhea. So we want to again tonify spleen 500 times, and we want to tonify large intestine. So this all works the opposite of the constipation. Large intestine, we will be pushing from tip of the finger to inside, so inwards. And then we want to clear small intestine, because we say that the intestines are not absorbing back the fluids, right? So we have to target the small intestines as well. And then we will do Nit Bangmen and Up Push Ne Ba Gua. So like I mentioned, these three, they always appear together: tonify spleen, Nit Bangmen, Up Push Ne Ba Gua. So especially for treating digestive issues. And then we have circular stroke fu. So for this, now we want to do it make this smaller. Okay, so for this we want to do it anti-clockwise instead. So for constipation it will be clockwise and diarrhea will be anti-clockwise. So we will do it against the direction of the how the large intestines go in the stomach. So and then for 七节骨 we also push it upwards. So you can see that a lot of these points we are doing in the opposite direction of constipation. And then very similar supplementary acupoints when the heat symptoms are a little bit worse, we do clear 天河水 and clear stomach, quite straightforward. And if the stomach ache is very bad, the tummy pain is very bad, and the bloating is also bad, we want to target a little bit more on the spleen system. We will use a knit 中脘 and also knit 足三里. So now we move on to chronic diarrhea. So this one refers to diarrhea that persists for weeks to months. So probably not that kind of diarrhea you see with food poisoning several times a day. More of like having loose stools. So these stools are usually not smelly, not so smelly as compared to the excess syndrome. And again, these children will generally appear weaker, looking paler, and maybe not gaining weight as much. Coldness in limbs, tongue will be pale red, and the finger vein will be pale too. So you might notice that the spleen deficiency symptoms are going to look the same for all three conditions, and the acupoints that we use will generally be the same. So this is what we mean by treating according to the syndrome. So for TCM, treating according to the syndrome is more important than identifying the condition. So you see all the points are the same for these different kinds of conditions with the same syndrome. So we have this same syndrome but different, we park them under different conditions. So this one is just depending on what the primary symptom the child is presenting with. Like for constipation or poor appetite, if either of them is the main presenting symptom, we'll maybe add a few certain acupoints to target the problem, but the general set of acupoints are going to be the same to help to treat the spleen deficiency. So for chronic diarrhea, acupoints for this, so you'll see that we have the tonify spleen, up, push, nei, ba, gua. Of course, you can also do the knit bandment, which I say always comes together. And for diarrhea, we will have to tonify large intestine also. So this is like the targeting acupoint. And also we will do tonify 三关. Because generally chronic diarrhea, we say that there's not enough qi, not enough yang energy in the body. So we want to tonify 三关 to strengthen the yang. So this one is at the thumb side of the forearm. You push from wrist crease to elbow crease. And then we have circular stroke 腹. Again, we do it anti-clockwise. And then knit 足三里 and our pinching of the spine.